Good morning, everybody. This is Dr. Michael Harkins from Harkins Chiropractic Center in Plymouth. I've been a chiropractor for 38 years, and we focus at our clinic on natural health care as much as possible. We work with other professionals also as much as we can. There's the Western medicine that we have in this country. There's also a part of healthcare that covers the human body, structure, function, neurology, structural relationships, function of organs, digestion, nutrition, and exercise, posture, mindset, things like that. So that's what we work our world in more. We don't want to forget about that part because it's such a big foundational part of our health. I graduated chiropractic school in 1983 from Northwestern College of Chiropractic in St. Paul. And we've been practicing for all these years ever since. We've helped thousands and thousands of patients as much as we could. And the body is amazing, the way it works. And if we can help it work even better, all the better for the patients. I have a brother who's a surgeon also, an OBGYN surgeon, and one who's a dentist. But this field appealed to me as a young boy. I was 19. My sister was helped tremendously. She had some bad injuries, and the medical doctors basically turned her into a drug addict at the age of 13 and cut her life short. The chiropractors in our local town in Wisconsin helped her tremendously. So that led me down this road. Otherwise, I'd probably be a dentist right now. So what we will do is I made a slideshow up here, and our clinic, we do a lot of our patients that come in have been through the traditional medical world for all kinds of problems, back pain, neck pain, headaches, injuries. We see folks with digestive troubles. We had a gentleman, a retired medical doctor, came in. He had Parkinson's. He had lost control of his bladder. He was like 73. And he got to my office and we showed him how the nerves come off the tailbone and the mid-back, the sympathetic and parasympathetic nerves. And that's how the brain can coordinate and run the bladder. So we worked on him. And I think within about 12 weeks, we had him so he could sleep all night. Otherwise, he was up about every 40 minutes to go to the bathroom. So he was able to sleep all night through. And all we didn't fix his bladder. We just made the nerve environment where it exits the spine structurally a better relationship between the bones, the discs, and the nerves exiting. So the body in a lot of ways is a internet system, and the organ systems they're like printers and scanners. They're waiting for information from the brain in a hardwired sense, not Wi-Fi. So our job is to make that kind of like a spinal technician, to make the spinal joints protect the nerve system, but not bother or hinder its activity. So in his case, for example, we helped him tremendously, and he had tried everything else. This picture I have on here, this is my cabin in northern Minnesota. That's Sunday morning humor. I'm sorry, but the human body and mind is incredible from what it can imagine, visualize, and create. Now, I want to go see that someday. Okay, the gentleman in the lower right screen is Dr. Palmer. Him and his father developed the principles of chiropractic in the 1890s. And the early osteopaths, which is a branch of medicine now, believed connections from the spine to the body for health had to be important and kept nice for the health to be shining through the body in a really nice way. They focus more on blood circulation. The chiropractors, the early ones, focused on the relationship of the nerve system to the spine to health. So all the cells of the organs and tissues of the body have to talk back and forth to the brain from conception to the last moment of life. They have to express energy and information. So with chiropractors, what we do is we work to make that relationship better. And then hopefully when the body's working good and the brain's working good, people can imagine beautiful temples or beautiful facilities like this and build them. This talks about different degenerations of the spine and nerves, etc. An actual nerve in the body is like a copper wire in your house. The nerve is on the inside and it's surrounded by a myelin sheath, which is like a fatty protective layer. That's like the orange plastic that might be that you see on the copper wire going to your light switch in the wall. So if that degenerates at all or gets worn down or agitated or inflamed, that affects the function of those fibers inside. It's all chemistry, electrochemistry. It's incredible the way it works. So we always want to do things that helps facilitate healthy nerve flow, nerve function, and nutritionally and structurally, the coverings of the nerves are protected. There are certain diseases where the covering of the nerves deteriorates, and these people have terrible, horrible lives until they die. So the opposite of that is to keep everything as healthy as we can. Healing forces of nature, we spoke about some of this already. And then in the Indian traditions in India, they have natural healing that goes back probably further than any place on planet Earth. The wisdom there is just incredible. But if the drug companies can't make money off of it, it's just kind of kept in the background. So you have to know somebody who can help you in some respects. Some of the Indian folks that come to my clinic share with me, people back in India that they're really enlightened. They can just sit with you. They can tell you what's wrong with you. They can tell you who your family is. They just know. So there's so much we don't know about life and health, but there are some people that do, but it's incredible. It takes incredible enlightenment and learning. Chiropractic, we try to keep it as natural as we can. The drug companies, they're more concerned, not that there's not good people in drug companies, but they're also very concerned about quarterly profit, and many times at the expense of the people who take their products. Like the vaccines right now, in the 1980s, there was a law passed that they cannot be sued for any damages caused by vaccines to children or anybody else. So if the vaccine kills you or you're damaged somehow, you have to sue the United States government, and they in turn fight you back, and they settle with you, but it's all kept pretty quiet. So it's quite an industry, and they call themselves a health industry, and they do some good. I'm not against anything people need, but you got to start with the basics too. If you've got all these problems in your spine, you're not eating well, not taking care of yourself, there's probably not a drug in the world that's going to save you and help you have a great life. Now, in this picture, the word subluxation, we've all heard the word dislocation. Dislocation is, if you fall and dislocate your elbow or your shoulder, it comes out of joint completely. Subluxation, this is the socket and a bone would fit in. It might be misaligned within the joint just a little bit or hung up. So sub means less than, so it's less than dislocated. So if you look at a spine here and this normal, there's the big vertebra, a couple of them with a big cushy disc between. There's a liquid center in here called the nucleus pulposus. It's like a liquid ball bearing. These are all fibers that circle around here. This gets wrecked over time, just from life, sitting, standing, having children, slips, falls, accidents. And the joints the weight comes crooked onto the spine, and it rips it along here. And then the joint starts to deteriorate. Then the poor nerve system is trying to come through the backside here. Here's your spinal cord coming down, and it's sending out these yellow little nerves out at every couple inches into the organs and gathering information and bringing it back. So now if this gets compromised here, physical, neurological, chemical stress, inflammation, this nerve can be shut down as much as 60% with the weight of a nickel on it or a dime even. It doesn't take much. And it doesn't have to be mechanical pressure. It can be inflammatory pressure, hydraulic pressure. And each vertebra here in your mid-back, for example, has 10 different joints on it, up, down here, and then above on the back on both sides, a couple different spots here. So there's lots of opportunities for stress, damage, deterioration. And then you multiply that along the spine. There's 5 lower back vertebra, 12 in the mid-back over here, and then 7 more in the neck. So there's just hundreds of joints in here, and nerve sensors, muscles, lots of opportunities for things to go wrong. So as people go through life, they damage different levels of their spine. And we're never taught much about how to take care of all of this beautiful system. and then it gets full of neglect and decay. Organ systems start to fail because they're not functioning properly. And then we go to the medical doctor, they do tests and MRIs and CT scans, and they get the prescription pad out and do drugs to try to force organs to work from the outside, when what we'd really like is to get things working good on the inside again, if possible. So subluxations they're bad all the way around. What we do, we find the areas of the spine. We use our hands and x-rays too. And I use a little instrument to slide down the spine, look for heat, one side to the other. We're looking for areas where it's stressed out. It's tight, it's not moving well. The joints should move and be real flexible. Just like your children, if you had little kids, when they're 9 years old, they should be all springy and joints flexible. When you get older and get subluxation, you lose a lot of that. It's easy to find. So that's what we find. We help restore motion and alignment and integrity to the vertebral levels. Then the nerve system at that level has a chance to function in the direction of where it should function better. We see a lot of children in our practice. This is the age where children should be trained on what they have. Some parents might do that, but most of us just grow up in a world where, you get a bunch of injections by the time you're 2 or 3 or 4. I don't know how many they're up to. I've heard it's like 72 injections now children get from the drug companies that are mandated by the time, they get into school. And that's what children think health is. It comes from a needle. But, we all know it probably really doesn't. It comes from, information, knowledge, what you put in your mouth, what you do with your body, your mind, and the people you hang out with, exercise. True health starts, with the basics of life. It doesn't, you don't let it just, don't ignore all that and then just look to the needle and the prescription pad to save you. It might prolong life, but we want a good life. We want a good, solid, healthy, happy life. It is a person that's, let's say when they get to be 80 years old and they are on 12 different medications, is not as healthy as somebody who's, same age with no medications. One is chemically dependent and the other one is their body's able to listen to itself, talk to itself, and it's doing better typically. So our goal is to get through life without medications. And if you're on any, what can I do to get off of these or at least reduce the amount that I'm on, whether it's through diet, exercise, etc. And we all know that, but a lot of us are too busy in our society, making a living and working and family and travel, and we just don't have time to take care of ourselves the way we should. But we always like to get the kids thinking about themselves. It's like giving your 16-year-old a new car. You don't just put them in there, give them the keys and say, go. It's nice if they learn what they have there. How does this thing work? How do you take care of it? There's a lot of mechanical fluids, electrical things going on. If they know that, they're more appreciative of what they have, and the experience with that car will be better. Our body is a lot of ways, it's a vehicle for our soul. And it, even if you drive a car real nice in your life, you wash it, you keep it out of the salt, it still shows wear and tear over the years. And our bodies are that way too. So you want to take as good a care as you can of it. So if you get to be 80, 90, 100 some years old, you'd like your car, your body to be in pretty darn good shape and not have to live your life like in a wheelchair or on a walker or on a bunch of drugs, things like that. Now, off to the side here, there's a little chart that talks about chiropractic for kids. We see a lot of these problems here, like digestive issues is one. I gave a talk at a private school once, grade school, and one of the teachers came up to me afterwards because I had spoken about how the nerve system runs the digestive system, etc., and to tell it what to do and when to do things. And she said, could you help my son? He's in 5th grade. He doesn't have bowel movements at all. And to have a bowel movement, he has to go to the medical doctor maybe every couple of weeks, and they fill him full of something and try to flush him out. It's just awful. The poor little guy. So I said, bring him in. Let's take a look. Because he's got bowels, so we know those are in there. The only thing he doesn't have, the connection between the brain and the bowels can't be working properly. Because when you eat a sandwich or some lunch, the brain kicks in and moves stuff along the tube. And his wasn't happening. It was just sitting there. So he came in, we x-rayed him in his lower spine where the sympathetic nerves come out and the lumbars right below the rib cage. Those are the nerve bundles that go down into the bowels. There's a bunch of ganglions called, they're like computer chips, and it sprays the nerves out and moves everything along. It gathers information back to the brain. So the brain knows what's going on. It's constant contact. Well, this little guy had a lot of, on the x-ray at least, it was really squished off, like that one picture, the subluxation. It was real evident there. I showed that to his mother. She goes, will it help if we fix this? I said, let's find out. So we worked on him. I gave him one adjustment. And he went home and he started having bowel movements thereafter. So we took care of him for about maybe a few times a week for about 6 weeks or so. And I haven't seen him since. He's been doing great. His medical doctor told the mother, I don't know what you're doing, but keep doing it. So I didn't fix, in that case, his constipation. All I did was change the relationship of the spine to the wiring that's going down into his bowels back and forth. We just made that nicer. He must have hurt that somehow when he fell as a child or something, and it never got corrected. You can take pills the rest of your life and laxatives and all this stuff and get flushed out. That's not going to fix anything. You want to get that wiring, original wiring working. And that doesn't just go for the bowels. It goes for your lungs. So things like asthma, acid reflux. We see a lot of folks with that. Acid reflux, the pyloric sphincter, or the, excuse me, that's the bottom of the stomach. The esophageal sphincter on the top of the stomach is a muscle that keeps the acid in the stomach. So if you eat lunch, the acid in the stomach should be strong enough to eat the acid or the paint off your car. It's supposed to be that way. But if the pyloric or the esophageal sphincter gets weak because the nerve supply to it is not strong enough, it opens up and then the acid can start climbing up into the esophagus. And you get this constant burning. And if you leave it long enough, it'll cause cancerous cells in the esophagus. So Barrett's esophagus, you don't want that. So what we do is we look, why isn't the esophageal sphincter holding shut? It's supposed to open just when food's going through and stay shut. So the power line is right between your shoulder blades, like around T5, thoracic 5, thoracic 6. Again, nerves come in, go into ganglions, these computer chips, and it runs into the stomach area and keeps that esophageal sphincter closed, keep the acid down. So we'll work between the shoulder blades, and that almost always takes care of that for people. The Western medicine cure for that is not a cure. It's to leave the acid coming up into the esophagus with a weak esophageal sphincter and give you antacids. Now, you don't want less acid in your stomach. That's where your food starts getting digested. If you screw that up, it goes into the digestive system undigested. Now you've got more problems. So there's a system involved here, and it has to be respected. It's how the body runs and regulates. Some of you may work in some big factories or businesses of some type, and you got products coming in, supplies coming in and products going out that you're selling. And there's a way to do everything exactly. Our bodies are a lot like that too, with food and sleep and oxygen. And you start screwing that up and tossing in cures and drugs halfway through, you get other products coming out the other side, which aren't exactly what you need. This just talks more about kids. You know, we all know what kids need. They need freedom. They need oxygen. They need to go run around outside with their friends. They need socializing. They need to read. They need to explore their imaginations. They need really good food. They need the good kind of food that isn't filled with flavor enhancers and all these different preservatives and all these things. That's not food. I always tell my patients the body wants good oxygen, good water, good food. That's what it wants. It doesn't want junk water, poison food, etc. So just think that way for your kids and your grandkids, and they'll be okay. And train them how to be that way as they go through their life. So when they grow up, they're taking care of their kids in the same way. I have some patients that were born in India. Their kids were born here, and they're the most wonderful people. The grandma ships all the spices and a lot of the ingredients for their meals right to their house from India. So they're not buying stuff down the street at a store or online. They're getting it from India because the grandma wants them to have the best. And then mom makes everything is homemade. Now, not a lot of us have that kind of expertise or time to do that, but that would be nice to have, healthy, happy little kids like these little ones here. And let's see. And then when we talk about the body, especially children too, there's this thing called neuroplasticity. Some of us may have heard that. And the brain has the ability to change. The brain is nothing more than a bag of organized chemicals. Our whole body is. And when you ask of it in a certain way over time, things start to change. And so when you get disruption in neurologic signaling, like it talks about here, the body can't communicate within itself the way it's designed. And that can manifest as different behavioral problems. So again, if you own a factory, let's say you're a manager, and the department over here is supposed to talk to the department over there, and it's supposed to talk to the department over there, and you can, in the end, you're going to be shooting a rocket up in space like Elon Musk is. Well, boy, everybody better be talking back and forth exactly, or bad things can happen. And our body's nothing more than that. It's a little factory, and everything needs to know what else is going on. And the more the brain knows what's going on back and forth throughout the body, the better opportunity for good health, neurological, socially, psychologically, physically, etc. So when you see a lot of things like ADHD, there can be some genetic components to things too, but you want to get everything as nice as you can so that that person can live to their maximum genetic potential is what you want. And they're even finding maybe you can even change genetics to a point too by asking over and over through this neuroplasticity. But that's something coming they're working on now, and we'll know more about in the future too. So with chiropractic, what we do again is we'll help. The brain is basically your big Apple computer, and it runs all of its wires down everywhere, and it's gathering information back and forth. It has to have blood supply, oxygen, nutrients in certain capacities. Cerebrospinal fluid flows around the brain, down the spinal cord. It's pumped with movement from the sacrum back up to the brain. It floods it with nutrition, lubrication, oxygen, electrolytes, carries waste products away, cools it. It's just an incredible machine. But when you have a lot of stresses along here, along the spine, it's kind of like having a beautiful little stream flowing straight down through a valley. Now, if you want to put a bunch of boulders and rocks in the middle of the way, the water would still get through, but it would create turbulence around the rocks, and the waters go around and over. And our spinal cord is a lot like that too. When you have a beautiful spinal cord that's just everything's lined up, goes straight down in an enclosed tube, and all the fluids and the blood flow, cerebrospinal fluid flow is good, you're probably going to feel better and function better. If you have bones that should be all lined up like this, and they're all going this way a little bit here, a little bit there, well, that cerebrospinal fluid has to go down like this a little bit, and it creates more turbulence in the body and more stress potentially. So when we get adjustments, we don't want to get adjustments for my back hurts. I pulled on a rock in my yard today. Yeah, we don't get that fixed, but you got to know that these subluxations occur constantly. They're happening all the time, just from injuries, posture, slips, falls, stress, mental stress. Things pull out of place, twist. In our society, we sit, stand all day at computers. It's just awful, and we're ruining ourselves. So anyway, problems along there can manifest. There's a lot of aches and pains, behavioral dysfunctions, and again, pills aren't really the answer. That's kind of like an iceberg. So when you see an iceberg, you see the tip coming out of the water, but below the water there's something very large piece of ice. And in our world, as a chiropractor, we want to focus on that below the water stuff. Let's get that fixed up, and then above the water will shrink down. The Western medicine pharmacy companies, they focus on the pain, the spasm, the inflammation that's sticking up above the water, and they sell you all kinds of pills for that, and that drives quarterly profit and helps the CEO keep his job. But that's not your best interest necessarily. So you want to actually find out what's causing that part sticking out of the water, fix that if you can, and then you don't need that other stuff. Aspirin, we know, eats your stomach away. We know that Nuprin, Advil, those kind of things eat your kidneys away. We know that the Tylenol, acetaminophen, destroys your liver. And if you have alcohol along with acetaminophen, you can have liver failure. Isn't that nice to know? So basically, they're toxins. So we like to use at our office, we do as natural as we can. We do recommend ice and heat at home. There are some natural things you can take, turmeric and curcumin and some of these things to help work with pain and things like that. So we try to have our folks come to us, keep it natural. There's a lot of stuff here about the drugs and stuff. And I'm not against drugs. I'm not against anything that helps people, but you want to try to get your foundation again, get it as nice as you can, and then see what you might need. During the pandemic, they stopped all elective surgeries. They left the chiropractors open in Minnesota. So I had people calling me that were on schedule for neck surgeries and back surgeries, but that had gotten canceled or delayed. So they came to me and we fixed almost all of them up. They didn't need surgery. And also we did nothing magical. We just evaluated structure, function, got things back as best we could, showed them how to take care of it on their own better, and they were good to go. Probably had a couple mad surgeons, but I had a patient once. She was about 73, had been going to chiropractors off and on her whole life. Wonderful lady. She had horrific eye pain behind her left eye for 3 years. It was just horrific. And she'd seen the best eye surgeons, the best medical doctors, the best. And they came down to this for her. And ask yourself what you would choose. And they gave her the options of killing the nerve off. Well, first they punched a hole in her eye, to suck some fluid out to see if there was too much pressure on the eye causing the pain. That helped maybe for a couple hours, but the body filled it back up to where it was supposed to be. Then they gave her 2 options: inject the nerve behind the eye and kill it off so she wouldn't feel the pain, or she could have her eyeball removed and get a glass eye. Now put yourself in her shoes. Which one of those 2 sounds pretty darn good? Well, actually, neither does. So she rolls into my office and I showed her a chart where the nerve comes out of the large nerves come out of the upper neck here and they go right up in behind the eye. And I said, if the nerves can get pinched in your low back or bothered and shoot pain down your leg, can you get pressure on a nerve here and shoot pain up behind your eye? She said, that makes complete sense. I showed her right on the chart, straight out of Gray's Anatomy, the anatomy book that medical doctors, chiropractors, dentists use in school. So we took an x-ray where those nerves come out and her neck was all degenerated, just worn right down. I don't know how the nerves got out at all. We talked to her about it. We gave her a chiropractic adjustment. It went beautiful. Within 45 minutes, all of her pain in 3 years was gone. All of it. So she comes back. She was so excited. She goes back to the surgeon and he says, well, what do you want to do? Do you want to get that cut or injected or take the eye out? She goes, neither. He goes, what are you talking about? Because I saw Dr. Harkins down the street here. He gave me this chart. See where this nerve comes out of the neck and it goes up in my eye? We checked there. It was all choked off. He adjusted that and all my pain went away. Here's what the medical doctor said. Now, this is one of the top surgeons, eye surgeons. You'd think he'd say, I want that chiropractor's name. Give me Dr. Harkins' name and address. I want to talk to him, see what he's doing. What did he say instead? Whatever helps. He slammed the file shut and walked out the door. So that's what we're up against in this country. The cost of the overhead in a surgical room, I don't know what it is, but they probably got to run a lot of bodies through those things every day to pay for all the equipment, the nurses, the doctors, the anesthesiologist, and the guy in that case, whoever's going to sell the glass eye, lost out a few bucks too. So, but I really don't care. I wanted to just help my patients if I can. So when you look at this little gal on the right here, I don't know how many of you can do that, but can you imagine the practice and the balance that her body has to learn since she was little? I don't know how old she is. That girl's like a teenager or what, but she probably started that with her mom when she was perhaps 2 years old. And what she's done is she's changed her brain and trained her brain cells to have balance of her body and control of her body that's out of this world. The average person could not do anything like that. And she makes it look simple. It is not. But the human body is absolutely incredible. It's just incredibly made, but we treat it like it's an old beat up lawnmower that we bought off of a garage sale somewhere. It's just a shame. And then we treat it like garbage. We feed it garbage. We don't even clean off our lawnmowers. We take better care of our lawnmowers than we do our own bodies a lot of times. But then we look to the Western medicine to fix things. Well, they don't have any answers for you. They've got a lot of symptom pills that don't address why Well, how can this little girl do that? They can't tell you, but that's learned. Um, that's neuroplasticity learned over the years. And if the body can do that, it can do anything. It can heal smashed, broken bones. It can heal cancer. It can heal digestive troubles. It can heal pain. It can heal asthma and allergies, but it has to be given a chance. See, she's got a brain up here and it goes right down her nerve systems, brainstem, down her spine, and it goes even under her little toes. Her brain is listening to her toes right now. Her brain is listening to her knees. It's listening to her hands. It's listening to her chin, and it's processing all the muscles to hold her just so. Now, a lot of us today, especially the younger generation, have grown up like this lady on the left picture here. This is all they know. So in my waiting room 20 years ago, I had catalogs on fishing or gardening, etc. People would read those. Now I have magazines. I have the same one for like the last 3 years. Nobody even picks them up because everybody comes in, gets their stupid phone out, and they're checking on whatever. So the human brain is obsessed with knowledge, and it wants to know right now about everything. And what's happening is we're disconnected from this poor structure, our car here, see? And then we get all these people coming in with these neck pains, migraine headaches, pain upper back, down the arms. We had a gal in recently, she had horrific pain in both elbows, 43 years old. Now, why would both elbows start hurting independent of one another? And she didn't fall or anything. But I told her it's all from her neck. When I'm talking to her, talking to her, she's looking down at her stupid phone. See? So she squished things off really bad here. So it took us about 12 weeks, and she had 3 years death spiral of pain. She couldn't use her arms anymore. Young mom. And in 12 weeks, we had her all fantastic. Okay, but you got to look at what you do. Try to over here. If you see this little lady that brings the phone up to a neutral position of her head, that's what we need to do more with our workstations, our life, our television, our books, instead of this way to the left here. This will keep my office real busy. I love being busy, but I hate seeing people suffer, and they're doing it to themselves. So anyway, when the body has a lot of stress on the inside, it just permeates through your whole body. You don't sleep as good. Your immune system is depressed. In this day and age, you want to do all you can to help your immune system be calm and peaceful and let it do its thing. And drugs aren't the answer to that. If you can't sleep good, what does medicine got for you? They got drug sleeping pills, but that's not real sleep. It's drug-induced coma, basically. You need the real McCoy. You need real sleep, deep sleep, okay? Now, I don't know if some of you play cricket. I've always been fascinated by this sport. I've never played it. I just like watching it on YouTube a little bit. But these guys are, if you're a high-end athlete, like some of these guys that play high-end cricket back in India and around the world, they got to take care of themselves. But see, when they retire, they quit taking care of themselves, and most of them get overweight, out of shape, eat bad food. But when they're training like this lady, they eat real good. They watch everything they eat. They get their sleep. But it's too bad we quit doing that when we stopped doing sports. And this just talks about, again, taking care of your structure, your function. Everybody does better, whether it's in school, etc. Now, some of you might stretch. Some of you on here probably have some interest in natural health care anyway. Maybe you're already doing stretching, movement. That's wonderful. Don't ever stop that. Do the things. If you feel really good when you're 20, you want to feel that good when you're 80 also. So what happens along the way, though, is we have children and all work gets in the way. Our energies get directed in the wrong directions. We give up on all the stretching, the playing outside, the riding bikes, the eating good, all the things. We need to treat ourselves like we're athletes our whole life. And when you get to be 80 years old, if God willing, we're in pretty good shape. And a patient told me this recently. 1 month in an assisted living nursing home, 1 month is about $9,000 a month. So take a good look in the mirror, everybody. Me too, I do every day. It's like, take care of yourself, because you don't want to have to go to assisted living. You don't want to be a burden on anybody. Why not be 90 years old and out running 5K races? Why not? Get out of that chair, shut that TV off, okay? Start eating better. Eat less sugar. If we can get rid of sugar completely, it's hard to do. This is more about stretching here. We got, these bodies we have are incredible things. And then we're finding out the muscles themselves store a lot of incredible, like testosterone and energy for the body. So, but we lose our muscle as we get older because sometimes, we don't have the testosterone levels, but at the same time, we don't use it anymore. If you don't use it, you lose it. It takes the body a lot of energy to keep your butt muscles, your glute muscles and stuff, and your leg muscles strong and big. When you were in maybe a teenager, you had nice, big, strong legs and back and butt muscles and stuff. But now we sit on our cans all the time, our butts, and these muscles go away. Why would the body spend energy keeping big, strong legs and muscles if you don't use them anymore? It's a waste. It's like running a company and throwing good money after bad money. So start waking things up again. Start thinking back to when you were children. What did you like to do? Get out there and do some bike riding, some walking, some hiking. You can stretch at home. You don't have to join a gym. You can get something at home, an exercise bike. There's all kinds of fun stuff. Look on YouTube. There's all kinds of things you can do right out of your living room. Here's a little stretch for the low back. Some of you may have seen something like this. Slow and easy. Keep one leg straight. The other one, bring it over. Do this every day on the floor. Just let that just hang there. It keeps this limbered up in the low back. And then go the other way here. Okay. And then the spine, along the spine, because we're hunched over all the time and our back is compressed down below here like an accordion, standing all day. We like to stretch it out a little bit too if we can. This is a very simple one. You can do this right in bed before you get out of bed. You can do it in bed before you go to bed. You can do it on the floor during the day. If you work from home, have a little rug, something like this, and just stretch your low back. And just hold it, let it go down for 10 seconds, bring it back up again, do a few of those and a few of the other ones, and that'll help you a whole bunch. Core strengthening, I'm big on this. How many of you have good core strength? Well, I'll tell you, if you don't regularly do core strengthening exercises, you don't have any core strength. I got these big, strong guys come in, and I'll have them do one little baby sit-up like this. So you start like she is on the right, that's where you start with your shoulder blades on the floor, and you finish on the left. She raises up till the shoulder blades are off the floor, and you hold that for a count of 5. Well, these big, strong guys come in, and they're shaking. They have nothing there. They think they do. They look nice in their shirt and tie, but there's nothing there. So when you don't have core strength, those are the muscles that run from your bottom of your ribs in the front down to your pelvis. That's tight. It's like a guitar string. You pull that tight, it keeps your low back. It keeps your low back stretched out. So tight muscles in the front, stretched low back. Weak muscles in the front, tight low back. And tight low back jams into itself. So you want to do little things like this. So I have my patients do those other 2 stretches we just looked at. This one and that one. Okay, if you sit or stand a lot. And then do this. And you do 15 of these a day, minimum, at a 5 count. So you go up like on the left here and hold it till count of 5. So if you did that and then finish up, maybe you pull your knees to your chest and then stretch the other way, you're good to go. Now you can incorporate the big balls they got too that you can lay over. Okay. I have my patients get those. They're like $15 at Target. If you're short, 55 centimeter ball. If you're 6 foot tall, 65 centimeter. If you're really tall, like 6'5" or something, they need a bigger ball, like 75 centimeter. But for most of us, 55 or 65 will do. You lay face down over it like a wet towel, and that stretches your low back open. Stretches out the joints like this, see? And then for the mid back, a lot of women come in, they're getting the hump on their back up here from a lifetime of doing this. So I have them get the ball and lay backwards over the ball on the floor. Keep your feet wide, head hangs, and arms like that. And that stretches the inside of the spine, the chest open like that. And that helps keep the hump away. Nobody wants a hump on their back unless you work in a church steeple, like Quasimodo in France. So anyway, I think that's about where we're at here. Trying to think. So we take care of a lot of our patients, are sent by other patients, and we love taking care of moms and dads and all the kids. And so we love what we do. This is a picture of our office to the right here. This is our X-ray facility. There's a big chart on the wall showing how the computer system of the body works. You learn about that stuff. We all should learn that in kindergarten, but nobody learns any of that stuff ever, for the most part. My office is in Plymouth. I'm over by the Hildy Entertainment Center, pretty close, right across from Lifetime Fitness, but up the side street towards the theater there a little bit behind Cub Foods. And so we do our own X-rays. There's our front desk at Halloween a couple of years ago. And let's see what else we got. I can show you here. we have some different tables and things based on what the patients might need for care. But thank you, Arun, and everybody for letting me talk today. Appreciate it.